Hi, my name is Kristle Morris and I am 42 years old. I currently work at Basis International School in Bangkok and I am originally from Oklahoma in the States. So over Songkran break, I went to Hua Hin with some friends and we went to get into the swimming pool and I misjudged the depth of the step and I fell and landed with a really hard impact and it caused pain to go up my back and down part of my legs. And when I came home, I came to the hospital the next day.
The patient come to see me with a low back pain spreading to her left leg. It is a sudden and severe pain for 3 days. The last day, the pain is progressed and she cannot even sitting or raise her leg. The patient was admitted to control the pain and investigation. MRI of the lumbosacral spine was done, and we found the prolapse disc of L4-5 compressed the nerve. Transforaminal epidural steroid injection was performed, and the pain was reduced. The patient come back to her daily activity.
So I had an injection a couple weeks after the initial injury, and the injection worked fabulously for about 2.5 weeks. And I could walk again, I didn't have any pain. And then after about 2.5 weeks, with climbing the stairs at school, going to work every day, it began to deteriorate. So I was at school and it was the last week of school, which is not a great time to not be at school. And I was walking down the hallway and both of my legs just went numb from the knees down and I fell face forward onto the floor. And they had to call the ambulance to come pick me up and they brought me back here, took an x-ray, and Dr. Setipong decided there needed to be another MRI and the disc had herniated, I think he said well over 50%. And he needed to consult with the surgical team and decide what procedure would work best.
The MRI was done again and we found the recurrent prolapse disc at L4-5, bigger than the first episode. With this condition, the patient had a neural deficit and the MRI showed huge prolapse disc. So we decided to make a surgery.
The only information I had was what I found on YouTube. So before that, I had no idea what it was going to entail. Now I've learned that it was very much needed, but also something I've told my friends that if you're going to get hurt, don't get hurt. But if you're going to get hurt here, because the surgical team and the spine team were fantastic.
Because the patient has very big body. So the surgery is designed between decompress alone or decompress and fusion. Because of the overweight, if we do the decompression alone, it is a higher risk of recurrence. So we discussed with the patient to do decompression by discectomy and make a fusion of L4-5 under the minimal invasive surgery, transforaminal lumbar interbody fusion of L4-5 under O-arm navigator that can make the accurate surgery, both decompression and insertion of the screw. With O-arm navigation, we can reduce the surgical wound to make a written surgical wound. Rest tissue trauma, make the patient have a lesser post-operative pain and shorter the hospital stay, reduce the blood loss, so reduce the infection rate too.
So after the surgery, I would say 90% back to normal. So surgery was, I think, June 24th, and it was right after school got out. So I had all summer to rehab. Before the surgery, I had to use a walker to even stand up or get around my apartment. I couldn't walk without it, had to lean on everything. And now I don't need anything. It's fantastic. I would say the first thing that impressed me was the level of care. And I don't mean that in the sense of their hospital employees, I mean in the sense of people. They were always super concerned that I was okay, always checking on me, coming in to see me every few minutes. Before surgery, the nurses that I'd had before came to see me. After surgery, the nurses have come to see me. So I think it's the people aspect is what makes the hospital what it is. Don't ignore it. It's one thing if you're in your 20s because you think you're invincible, but when you get a little bit older and the pain just doesn't go away with rest and heat and ice and medication, then you probably need to go get it looked at.
I think that in our lifetime, everyone should have a back pain. But what is the dangerous back pain that need to come to see the spine doctor? The back pain that persists than 3 months, the back pain that's spreading to the leg, the neck pain that's spreading to the arm, the numbness and weakness of the arm or leg that come with the back and neck pain. I think this is the dangerous back pain or neck pain that you need to come to see the doctor.